Thank you, Doctor. No, wait a second. Thank you, Doctor. I would like to take the immense pleasure of inviting Dr. Gordana for felicitating him with his speaker certificate. Thank you, Doctor.
My congratulations. Here is your certificate. You're welcome. One, two.
We'll carry on with our last oral speaker for the day, which is Dr. Bebe Kakar, who is the Vice President of the National Association of the Structural Integration India and founder of Dr. Kakar's Comprehensive Physiotherapy and Rehabilitation Center. Please welcome Dr. Kakar from India, who will be speaking on the role of TMG in the low back pain clinical perspectives. Please welcome him again.
Hello. Yeah, thank you everyone for participating for this PTRM 2022. My name is Vivek Kankar and I would like to say namaste to all of you from India. The topic for the day is role of temporomandibular joint in low back pain. Now, something people do talk about but very less worked upon. That is what I have found out in my 15 years of clinical practice. One thing which I would like to start with is I will not be eating your heads with a lot of research data, which everyone knows it's becoming pretty heavy by the end of the day. Me being the last speaker, I will not be talking much about the clinical researches, but only the first 3 slides or 4 slides max. I'll be setting the foundation and then we'll be talking more about how you guys can experience what I'm talking about. 15 years of practice in temporomandibular joint. I'm pursuing my PhD in this subject, trying to coordinate how TMJ can control, repair, and rehabilitate spine. When I say spine, I'm not limiting myself to only spine. It is such a sensitive topic that every single person sitting in this room has something or the other which can be connected to their TMJ. I was sitting at the last seat and I was observing everyone around. Our friend Orobi, we were discussing with, was finding it difficult to do that exercise program outside where he was unable to do the arm movement, and I realized that diaphragm, he was unable to breathe from the diaphragm. Our friend Abdul from Pakistan, he was discussing things about facial paralysis. People are talking about everything. Every person who has come here and spoken has spoken about every aspect on which they see the world. But this is something which we see, but we don't observe. So I would like your keen attention and observation. It might help me creating a water ripple effect. And all of you, when you go back to your practices, can start making a big, huge change by a very, very subtle maneuver. As you can see from this slide, there are 2 skeletons, and if I'm correct, yeah, both of them are moving. These are biomechanical changes which are happening in the spine, and how are they connected? We will come to that. Quickly, I'll be going through these slides. It's practically a read through, nothing much to understand beyond what is written. So, low back pain is a common global problem. Global burden of disease studies have defined low back pain as the pain in the area of posterior aspect of the body, from the lower margin of the 12th rib to the lower gluteal fold, with or without pain, referred to one or both lower limbs. Now, if the key point here is also that low back pain is the common global problem, so much so that it was estimated to be 7.5% of the global population affected with low back pain. That is 577 million people. That means practically every 10th person you meet is living with low back pain, sometime or the other in their life. Low back pain is not usually associated with a specific identifiable pathoanatomical cause. That means every person sitting in this room, sometime or the other, has gone through low back pain, occasionally or maybe chronic. But why? It might not be same for everyone. That means we are left with so much to find out, so much to correlate, so much to evaluate, that we cannot ever come to one consensus about why this is happening. And in doing so, we can either think about working at the site of pain, or we can go about finding the cause of the pain. Like right now, all the respected and beautiful ladies in the room, majority of them are sitting with high heels. All of them are using or excessively using their abdominal muscles rather than their glutes to propel their body forward. I'm talking about the biomechanics of the body, with no disrespect to anyone, that is also shutting your glutes. And when your glutes are shut, your body is, the center of gravity is falling forward. What is balancing? The abdominal muscles. What is balancing further? Our SCM. And who is controlling our SCM? Our TMJ. Over a period of time, I also observed one lady in the room was eating a chewing gum. Maybe it's a habit, maybe it's lifestyle, or maybe something where they are dealing with their stresses, or they are trying to relax their masseter and buccinator. Why? Why do I have to release something which is constantly active and on guard? This is our habit of continuously working on our stressors. Very, very subtle things, which ultimately are living with us every day. Low back pain is the leading cause of global disability as well. This says approximately 70% of years lost through disability were in working age people of 20 to 65. So, coming to this, it's a serious problem. I'm trying to put forth my observation of 15 years of clinical practice into this. Researchers from TMJ. Well, Weisinger et al. In 2009 concluded a reciprocal dose response like relationship between spinal pain and TMD. The result indicated that these two conditions may share common risk factors or that they may influence each other. I've kept this online so that if you want, you can go to the British Medical Journal and you can get this. Lee Casey et al. In Jan 2020 concluded low back pain is a risk factor contributing to the development of the first onset TMD. TMD is a nightmare for the dental surgeons. TMD is a nightmare for all those people who are working in the world of TMD because patients are never satisfied with one doctor. They go doctor shopping because they don't find results with one doctor. Ultimately, they end up getting frustrated. This is what the TMD studies have shown. Because people who are meeting their first oral surgeon or first dentist, the local dentist nearby, all they are finding is either the devices to put for the night sleep, or the devices to arrange their dental occlusion, or they are finding the extraction of the teeth, or they are finding other things. No dental surgeon is going for strengthening of the microligaments, disc level work, maneuvers. Physiotherapists, on the other hand, who are working in tandem with the dental surgeons and the other orthopedic doctors who are working on the TMD disorders, are finding it difficult to explain to the patient that what is the role and the importance of the jaw joint. And this leads to such a catastrophic event in the life that the person, by the time he realizes that, okay, I need to work on my muscles, is frustrated with visiting so many other doctors. Coming to the point of Kim D. et al. In 2019 concluded that a strong association was observed between the presence of TMD and the presence of spinal pain. The association became stronger as the severity of TMD increases. This also brings me to the topic of stressors. As we stress, how we respond. All of us in our life have gone through challenges. We still go through, like today, Abdul got late because of the traffic. He definitely must have felt so bad that, okay, I was supposed to be there at some time and I could not be there. I want to attend this World Congress. And what could he have done? Clench his teeth. Why? Because he wants to express his anger. The basic first emotion of expression of a human being, anger. Anger comes from fear. The primary controller with whom we can govern the world. The global economics is governed by fear. The global politics is governed by fear. Humans are schooled and disciplined because of fear. That's our basic element after love. We can win over a person either by love or by fear. So, coming to that factor, our jaw represents our stresses. Now, depending upon how the person is living the life or perceiving the life, the stresses are getting accumulated. So as the stresses increase, so does the pain. How? Coming to the foundation. Now I have touched some topics, but there are many left yet. So I'll be touching various aspects of how TMD or TMJ can be governing, controlling directly, indirectly, or in a chain reaction to our body. There are different ways, different school of thoughts, different aspects through which we can reach and access this specific target. Starting from the first, diaphragm. I don't know how many of you in this room are aware that we have 8 diaphragms, major 8 diaphragms in our body. I'm not sure how many of you follow the osteopathic schools and how many of you follow the chiropractic schools and how many of you follow the other researches of traditional Chinese medicine. But this is something which is fact, well documented, well researched. We have 8 diaphragms. What is a diaphragm? Diaphragm is a layer which creates a partition or creates a bridge between the two compartments. It absorbs the pressure or participates through taking the pressure to the next compartment so that we can lean over. It's like wife. We can lean over when we are down, but she can lean on me when I am down or she is down. So these are the things is a diaphragm. They work in tandem. Now, if one diaphragm of your body is affected, all the diaphragms are affected. How and why? Because body is one unit. School of thought from osteopathy, Dr. A.T. Still. I am also an osteopath and from University of Ontario, Canada. So coming with osteopathy and coming with the school of thoughts about diaphragms, if you have an ankle strain, what is the first reaction you have? It's pain, it's stress. And everything comes to your head. What were you doing? What were you about to do? Females out here, if you have a twisted ankle and you're about to go for a presentation, you're standing here with the pain, you will not be able to move around as easily as you want to. What will happen? The diaphragms are getting affected. First diaphragm ankle, second diaphragm knee, third diaphragm pelvic floor. Pelvic floor, the reciprocal counterbalancing of your jaw. Human body is given 2 openings from the trunk. One at the neck, that is the mouth level mandible, and one at the pelvis. These 2 work together in tandem. I'll come through this. Let me complete this. And then comes our actual primary respiratory mechanism diaphragm, the respiratory diaphragm, which is right under our lungs. This is basically the intersection. It's the biggest, it's the largest, so we call it as the primary diaphragm. Whereas if we look up, we have one in the cranium. We have one in the eye. We have one in the mouth. We have it at so many places. We have it at throat. These are the diaphragms, the intersections which connect the other compartments. So one school of thought, diaphragms affect, TMJ affection will come to our back because jaw and pelvis are interconnected. Second, tensegrity. In any structure, in any kind of stability, in any kind of movement, dynamics, kinematics or kinetics, tensegrity plays a role. Again, this comes to the point that we are moving our body in a particular direction. We are moving our body in a particular direction. We have to have a strong foundation. We have to have our grounding. We have to have our long lever arm and short lever arm in alignment. Then only we can put the weight, put the force, put the target directions what we want. All of this happens when the weight, the force, the connections are distributed evenly. Tensegrity means if I'm pulling my shirt or my coat from one side, it is also like if, for example, if this is my shirt, I'm pulling from this side. Maybe you guys are focusing only on the pinch I have in my shirt, but there are other places in which this can be seen getting pulled up. The fascia which is getting pulled up is from the other contralateral side. This fascia comes into the picture with tensegrity as one wrapping thing around the entire body. It's like a jumpsuit, like a swimsuit. Now, enough might have been said, might have been learned about fascia by you all, so I won't be going into details of it. But fascia, the wrapping gift wrapper which God has given us, if you believe in God, this is something which you need to understand, is the strength wrapping which we have, which connects every single cell of our body, and this also creates the tensioners. Second thing, if we go by the cut section of our body, the second photograph which you can see is the diaphragm is connecting directly to the psoas, when the psoas is getting connected to the diaphragm, that means our breath and our movement are interconnected. You cannot move if your psoas is locked. Psoas is primarily, now in my 15 years of experience, thanks to my teachers, I learned it pretty well fast that if I have a patient who is not able to move because of back pain, radiating, sciatica disorders, everything, 30 seconds is all it takes. In my clinical practice, proven time and again, I hit the cluneal nerve with dry needling, patient is walking. I have been barred from many hospitals because I went as a friend for helping my fellow friend. I went there, I saw him, he was posted for surgery. I said, give me 30 seconds. He lied down on the other side. I checked which side is getting more affected, hit the cluneal. I'm talking in a World Congress. Maybe many orthopedicians might not like it if you are listening to me, but this is something for all the physiotherapists. Hitting a cluneal nerve properly makes the person get out because the psoas gets open. Psoas is the muscle which shocks you, stops you. Coming to the energy medicine and the emotion aspects of it, the biopsychosocial model, psoas is the muscle of fear. Now, if we have a shortened psoas, how can we breathe? If we can't breathe, how will our body, with the sense of tensegrity, be allowing our jaw to move? So indirectly, if we are locking lower, we are locking upper. If we are locking upper, the same reverse action will happen to our lower body. That's how the front and the inner central segment of our body are interconnected. Now we come to the vault. I spoke to you about the outer wrapping. I spoke to you about the inner connection. Now we talk about only the trunk vault. Here, if you understand, the diaphragm and the psoas coming together makes a picture of a capsule. There's a pelvic floor at the bottom, there's a diaphragm at the top, there's abdominal rectus muscles in the front, there are posterior back muscles at the back, posterior segment, making a capsule. Connecting from within is the psoas. This is where walking meets breathing. Very important factor. The closer aspect of our jaw is our diaphragm. The farther aspect of our body is our psoas. But if the pelvis is affected, diaphragm is affected, jaw is affected, diaphragm is affected, in both the situations, back pain can arise. So far, so good. If somebody has taken some aspects of my conversation, good. If I'm getting too boring, I'm sorry. I'll just put up some more minutes and I'll be able to explain you more deeper. There's a photograph here which shows the anatomy trains video or the photograph of how the fascia is connected from tongue to our foot. This is one deep central chain. This is how our tongue is connecting to the foot. The other aspect is the deep posterior chain. Various talks, various people, various researches, various ways and labeling and branding. I'm not going into those, but all I'm trying to explain you is our head is connected to our toes via various continuous chains. From this, one comes the temporalis pterygoids and masseter coming in continuum right till your lateral chain muscles coming to your foot. Now, there are many people in this room who have TMJ issues. I saw you guys checking your own TMJs. If you have one tight masseter and you stand and observe yourself, you will find that side ankle deviation. Anybody can stand and check it in the room. This is well researched, well tested. There is a deviation in the ankle, there is a deviation of your foot posture, there is plantar fasciitis, there is flat feet, there is everted feet, inverted feet. All of these are in direct correlation with whether your pterygoids are tight, whether your masseter is tight, or whether your temporalis is making you notoriously getting affected every time you try to do a task. Temporalis is the silent killer for many, many issues. It's a very, very short time for me to explain things in detail, but I hope this slide explains you that how the outer controls of the TMJ are governing the lower part of your foot. And this is a very subtle input which I'm trying to explain to you, that how back becomes the fulcrum as the crux of the problem in lower back, as a fulcrum for balancing your feet and your head. Now comes, foundation is done enough. I've said enough. I'll be coming now to the cause of concern. Why do we have back pain? Why do so many people in this generation, so many young people have back pain? And right now we have 3 people in this room who are doing exactly the same thing. Checking their phones, 1, 2, and 3. No shaming anyone. I'm trying to inform you that how your neck postures are. This explains how much loading you do in a day. Thanks to the beautiful iPhone screens, super OLED screens, super AMOLED screens. What's going on? This is all from the research data. I'm not going into the research analysis. Understand what's happening. The basic physics, what we learned in our school. If our head is going forward, the body is going to balance it. The back posterior chain muscles are going to counter support it for a period of time. Over a period of time, if we keep going through it, what's going to happen? They're going to lose their control. It comes on your SCM, it comes on your chest. Half of this room is not able to breathe fully from their diaphragms. No offense. Why this is happening? Because habit is this. Females are, there was on the very third slide, there was information that females are more prone for low back pain than males. Thanks to the beautiful anatomy of the body, they have more weight in the front because of their breast weight, or because just they are wearing their brassieres tight. So either it is fashion, or it is compulsion, or it is a requirement. You are holding your diaphragm, you can't breathe. To sustain that, you are pulling yourself forward. Eventually you are bringing your COG forward. Eventually you are overloading your rectus, which is going fatigued, and then you have your occipital muscles getting fatigued. This is in direct correlation to my next slide, which says occlusion. Now, all of you can try this. If you guys have no problem with your occlusions, or if you guys are not aware of your occlusion, understand this point. Close your eyes and try to approximate your teeth, open them and close. See, how are you guys doing it? What is touching first? The front of the teeth, the middle of the feet, the front of the tooth, the middle of the teeth, or the back set of the teeth? Now, drop your head forward as if you are tucking your chin to your chest. Do that and then close your mouth and check how are you guys doing it. Thank you for so good participation. I really appreciate the audience. When you do it, you will realize that the front of your teeth are touching before. When you're dropping your head, the first thing which comes up is the front of the teeth. Now, take your neck completely back, drop it, and now try closing your mouth. Open and close your mouth. The back of the teeth. The occlusion changes with the neck posture. That informs us that the center of gravity is not just dependent on that specific alignment tester which we have in the dental surgeon's office, but we also have, because of our habits, of how are we living our day, how are we keeping up our head posture in alignment to our shoulders. I hope all of you are in sync with me here. And this brings us to the topic that how biomechanically the first 3 vertebrae in the neck move in the same direction as the last 3 vertebrae in the lumbar spine. This is a low-rate reactor principle. I'll come to that. There's a study which says that every single vertebrae in your cervical spine is rotating in tandem with every single vertebrae in your lumbar spine. There's a correlation, direct correlation. I'll come to that in the next slide. Also, if the TMJ is malpositioned, the first 2 vertebrae of the neck undergo torsion and rotation. This compensation ultimately compensates all the way down to the spine, which is a direct correlation, which is here. So the Lovett reactor relationship is what I'm talking about. Very detailed. I'm sorry, ma'am, if I'm boring you enough, but just more 3 minutes. The Lovett reactor relationship says that according to this, each vertebrae is coupled in motion with another vertebrae, and the pelvis is coupled in motion to the cranium. C1 plus L5, C2 to L4, C3 to L5 automatically moves in same direction, also known as the coupling movement. The other vertebrate pairs, like example C4 and L2, move in the opposite direction. This is something which probably none of you was aware of. Very simple thing. How our body works in tandem. Correlation of our neck to our spine. Observe, when we walk, we keep one leg forward, automatically the opposite hand comes forward. Why is there a cross relation? Because we want the torsion of the body to be minimum. Now with this biomechanics, sir might be able to help me because of the mechanical tools which he has in the computer. With this torsion forces coming to minimal, the center of gravity coming in the center, we trying to be upright, trying to recruit our glutes and moving. If we have our neck forward, all of this collapses. So where is the strain coming? Again, the fulcrum, which is trying to hold our body against gravity. This brings us to the final conclusion things. So if the TMG is in imbalance, there is a subluxation of C1, C2, which ultimately irritates the nerves. Also, there's a constant stressor because of the C1, C2 irritation to the trigeminal nerve, indirectly to the vagus nerve. We also have stressors of emotional levels, which are sympathetic and parasympathetic in nature. From here on, the entire spine is distorted, and we also find scoliosis, kyphosis, and other issues. Ultimately, whatever I have said so far, if I have to sum up in one slide, that is this, that there's a ripple effect throughout the body and the posture changes. What are the solutions? Said enough. I'll give you one simple thing. There is nothing better than saying the truth. When you say the truth to the patient, sooner or later they understand that what is going on, how much are they participating in the recovery. There is no doctor on this planet who can say that he treated the patient and the patient got fine. It's the patient himself, the energies, the environment, the family, the conditions, everything come together to allow treatment and healing to the patient. I will never ever take the entire credit only to the doctor. I never do that. I always give credit to my patients. So the action plan is very simple. Our job is to connect the dots, find out the proper history, take the traumas. Trauma can be as simple as, I have a patient being treated here. Everything was fine. She had some issues. And I asked, what's going on? Where is the scar? She said, nowhere. And I realized there was a scar right at the tongue, in the middle of the tongue. And that created a lot of havoc in my head. I can be treating the entire body, but I cannot be treating because there's an issue with the tongue. And this is the last slide, just last slide. Okay, so identify the cause, see the effects, how are they coming, and we get to know that where is the trauma connecting to the entire body's fall of events. Having done that, the next part is to observe how this trauma can be identified and informed, not glorified. You have this problem, this is going to take this many years, this is not going to get solved. No, I condemn this kind of approach, the nasibic inputs from the fellow physios. I strongly urge and request all those people who are seeing me online, please do not use nasibic inputs. Please encourage your patients to understand the problem and participate in getting this problem resolved together. Restoration plan with able execution. Discuss the plan. Talk to your fellow colleagues in physiotherapy department if you're not finding the proper solution. If you think you are not able to do enough, talk to your fellow physios. Find the plan for restoration. Unite, being with awareness. It's a very vital thing to do. Misuser. Unite, being with awareness. Your patient is as good as he is aware of what are the changes happening. Your patient is as good as he knows that what he's going to do will bring what change in his body the minute he or she leaves the clinic. So when his being is associated and united with his or her awareness of the body, how is she landing her feet, how is she landing her neck, how often is she misusing her body, where is the posture, all those subtle things. The entire world is filled with this extra data and inputs about what are bad things. How many of us are actually practicing it? Bringing that to the most subtle part, the touch. Nobody can take it away. My friend Abdul said this in the previous presentation. He strongly believes in manual therapy. So do I. I'm also an osteopath, I just said. I also am a practitioner of structural integration, which is working purely with hands. With this kind of manual therapy works and body works, what we come through is we can mold bones, we can bend bones, we can identify and create huge changes in the body, including scoliosis and kyphosis, conditions which are chronic and conditions which are autoimmune. They change. I have been lucky enough to visualize these things, participate in such condition patients. So what I'm trying to say is touch, treat, and transform. That compassionate touch. My teacher, Dr. Steven Sanet, had taught me this. That compassionate touch which you have with the patient is enough to set the stage for allowance to change. Healing comes only when we set the stage and allow the patient, and patient allows us to bring the change. Rest, we invite the patient to make this godly puppet come in position with his or her awareness, with our inputs, with our efforts. With this, she's my beautiful wife, and I would like to thank you all. The motto of my clinic is limits exist only in mind. I have been working tirelessly since 15 years trying to get this thing done. Bringing TMJ and its subtle effects on the body to the public. Thank you.
Thank you, Doctor. Thank you, Doctor. Thank you. I would like to take the immense pleasure of inviting Prof. Dr. Gurdana to felicitate Dr. Vivek with his speaker certificate.
Very interesting presentation. So take care of yourself. Have a good posture and your patience. And thank you for everything.
Yes.
Thank you. 1, 2.
This one.
This.
Thank you.
Okay.
Thank you.
Congratulations.
Okay, thank you everyone. Now we ended the oral